people are starting to think about freezing down their reagents that they were thinking about using on Monday. They can't use it on Monday if we shut down. So you don't want to freeze it because you don't want to freeze it unnecessarily if we don't shut down, but you got to be ready to be able to do it at 1 o'clock in the morning before the next deadline comes. So it's a scramble. So if you would ask me, pick out one word, what's going on at the NIH right now, it's a scramble to address the possibility that we're going to be shutting down. The effect that's from a practical standpoint is that when you're dealing with science, you have experiments that have been going on for months, if not years, and then all of a sudden you got to stop. You can't do that. You can't push the pause button on an experiment when you inject an animal with a particular substance to see what the response is, and then you have to go home for a week, 2 weeks, or 3 weeks. So it's really quite disruptive to the science, number one. And number two, it's very demoralizing to the people that they have to stop what they're doing when they're doing it because they want to help people. That doesn't work well. I mean, obviously, you never want to put patients in any jeopardy. So what halts and pauses and stops is that if you have a patient in the hospital, I have my own patients in the hospital, we still take care of them. We don't say, by the way, government closed, clinical center is out. But what you don't do is you don't admit new patients into a protocol.